Hi everyone, I'm Dr. Sandeep Sharma, Pediatric Super Specialty Faculty at PrepLadder. And INI Super Specialty results are out, and we have rank one. Yes, you heard it right. Rank one in DM Neonatology, Dr. Ihina Tinna with us. And I'm also very happy to say that she's also a product, she's also a pass out from PGI Chandigarh, which is my alma mater as well. So doubly happy to invite her to this interview. So congratulations, Dr. Ihina, and welcome to this interview.
Thank you so much, sir. It's my pleasure to give an interview to you.
Pleasure is all mine. In fact, we are all very, very proud of you. Uh, Dr. Ihina, first of all, tell about your background and where you are working right now.
Sir, I belong to Bikaner, Rajasthan, and I did my UG from Lady Hardinge Medical College, after which I pursued my PG from PGI Chandigarh, and I completed it in December 23, after which I was at home preparing for 4 months.
And this was your first attempt, right?
So I gave an attempt in November as well, but that did not had my heart and head because I was confused between neonatology versus pediatric cardiology. So I had to make up my mind before giving a full-hearted attempt. So yes, a full-hearted attempt, it would be counted as a first attempt.
So now that you've given the exam almost 2 times, so you must be having a fair idea like how the exam is there, and like the weightage of the exam, what are the areas from where questions are repeatedly being asked. If you could help the audience, the students who are targeting this particular exam, the DM neonatology part, they'll have a lead on what areas to focus on.
So first of all, I would like to mention that almost 80% of the neonatology part will be covered from AIMS protocol only. The new protocol precisely was covering a lot of topics which were not there in the earlier protocols. So they were focusing on those chapters which they have added new, which would include the prenatal part, the perinatal part. And there are specific topics which AIMS is always fond of asking, as we have already seen in the PG exams as well, that AIMS is fond of asking a few topics and it does ask that topic repeatedly. Same is the case here, that they will ask about NEC, they will ask about AEDF, REDF, they will ask about respiratory disorders in general. One question will come from there, one question will come from a cardiac disorder, an approach to cardiac disorders. So if we have a broad idea of what previously is being asked, if we follow the seniors very clearly, then we can crack it easily.
And what about the department assessment, Hina?
So for departmental assessment, I had consulted a lot of seniors. I had 3-4 seniors, and they specifically told me to have a protocol-based approach for every disease that the neonate might have. So I did AIMS protocol only, but I made sure that I have a protocol of every disease in my head, that what would be the next step, because this was told to me that they will focus on what would be the next step. If a complication happens, how will you treat that? If any different scenario happen, how will you handle that? So I had that in mind, and then I was preparing for departmental assessment for the same.
So very good advice given by Dr. Hina. Focus on, if you're targeting neonatology, DM neonatology through INISS, focus on the latest AIMS protocols. And every protocol is important, including the new additions they have done in this edition. Secondly, there are some typical AIMS topics. You can easily go through some MCQs, you can consult. Even in my videos also, I sometimes tell you that these are the things which are very frequently asked. NEC is something like, if it is not asked, it becomes like a why have they not asked. So it is something that you have to know in details. Plus department assessment, protocol based, what is the next step, that kind of approach. It will take time, but as you can see, Dr. Hina had that clarity, she prepared accordingly, and she has cracked the exam. So Dr. Hina, what were the resources that you utilized during your preparation, so which you feel helped you in cracking this exam?
So, sir, I had 4 basic things in my hand. First one was AIMS protocol, which I read thoroughly from first page till the last page. I made sure I don't leave the annexures. I made sure I don't leave even a single line of AIMS protocol. That was my first basic source that I have gone through. Secondly, as seniors had told me, that Clohati is also necessary, especially in those topics which are not covered in the AIMS protocol. So if the topic was being covered in AIMS protocol, I would follow through AIMS protocol, but the topics which were not covered, I would cover it through Clohati. Nelson, I used for pictures, images, diagrams. I have gone through the tables as well, at least once, so that I don't miss on those topics. And PrepLadder, neonatology, I had seen all the videos at least once. I also have seen some of the videos twice just to revise it through, and did the MCQs subsequently with that.
So Dr. Hina had a very clear thought out strategy. इधर उधर नहीं जाना है. She was focusing directly on what is important. The most important thing, AIMS protocol, then Nelson tables and specific parts, then Cloherty specific areas which are not covered, and then obviously PrepLadder she has used. So PrepLadder SS, the super specialty PrepLadder part. Uh, you solved MCQs also. Did you give grand test? And what did you find? How did you find it useful for your preparation?
So I had PrepLadder from my end of fifth semester, starting of sixth semester. After submitting my thesis, after I was done with it, I used PrepLadder very thoroughly. So since I knew that you were covering whole of the Nelson in your videos, when I was reading the chapter and then I was watching your video, I could realize this, that sir has taught each and every topic from Nelson, covered everything. So whenever I used to read in my PG days also, I used to read the chapter, then I used to listen to your videos, solve the MCQs. I could not go through all of it because I could not cover the whole of Nelson at that time. But I made sure the important topics, the topics that were covered in our lectures. In PGI, we have lectures. So I made sure the topics that were told to us that they are important by our seniors. I covered all those topics from the videos and then solved the MCQs of that as well. I did not give the grand test because I was short in time. So I focused more on the previous year question. I had seen a lot of videos that you have made, and you have told that these are the previous year topics that are being asked. So I focused more on those topics, and the MCQs I had focused on the MCQs more rather than giving grand tests.
Thank you so much, Ihina. Lovely to hear that our efforts at PrepLadder SS, they were of some use to you. So, Ihina, another thing, like when students are targeting the exam, when they are doing their MD or DNB, they have very limited time available.
Yes.
So a lot of students who are listening to you, they might be first year or maybe early second year residents. What advice would you give to them? How they can, obviously they cannot totally, go into the exam mode. How they can plan according to you, if they are targeting and want to crack in the first go or the second go after they finish their MD?
So firstly, I would say we can divide it year wise. Like in first year, what is more important is to learn the practical skills and the basic knowledge. Because when we come from MBBS, we don't have a good hands on children as compared to the adults. So the practical skills that we have to acquire during our MD days is very important in the first year. Plus the basic knowledge which our seniors would teach us, which we see very frequently, we should focus more on those. In second year, I would say they can start reading Nelson thoroughly because we start taking cases, we start attending bedside classes. So we should focus more on Nelson rather than going on to different sources. Nelson and your videos, I think, would be enough to focus in second year. And in third year, they can at least have an approach of which field they like, which branch they would want to pursue further, so that they have an idea in their head, they have a mindset about that later on, and then they can follow specifically towards that field.
Some students have actually asked me, and I've at my personal capacity I have discouraged them, but they are like, sir, it, academics are okay at my place. Should I, now that I have to do super specialty, should I focus more on preparing for the super specialty exam? Personally, I've discouraged that, but your take on this, because this is something which is very important.
Sir, I would also go with your thought only, that I would not like to encourage students to start pursuing it from first year or second year. I think the basics have to be learned first. At the end, we are a pediatrician first, and then a super specialty will come further. So at least having a broad idea of what a pediatrician has to do, because anybody can ask us any question as we are pediatricians. At the end of the day, we have to have that basic knowledge, and then they should focus on super specialty, not just jump onto that just because they have to crack an exam.
Absolutely, and a very good message given by Dr. Ina, that you have to first get the skills. In between, you get time. In between, you get time. There will be free postings, easy postings, OPD postings. You try to in PGI you have the social pediatrics postings and similar postings where the workload is less. There you can plan out. Maybe you can do some MCQs, but please focus on clinical teaching, bedside teaching, the morning rounds, the grilling at the rounds. It looks bad, it feels bad sometimes, but again, it is going to actually help you out once you sit in the exam, because that is end of the day, life is not about solving MCQs. You are there to treat the patient. So Dr. Ahina is a typical example. And before this interview, also she was saying that how the place, the from where you do, how that helps you in cracking the exam. What is the importance of the college, the patients that you see in actually helping in the exam also?
So I would tell my own example in this case, because when I was reading, I actually used to recall the patients that I have seen. And then I used to correlate that, okay, this was the clinical feature that I had seen in this patient. This was the history that was given to me by the parents. And then I would remember them better.
Hmm.
So, and in PGI, we have this that since the patient load is more, we get more exposure. We get to see a lot of cases, and broadly, we cover almost all the cases, all the important ones, all the basic ones. And when I had seen the case, I could recall them better, I could remember them better, and I could correlate with the management, with what decisions are being taken by our seniors. So that helps if you are in a good place, if you have good surroundings, if you have good seniors who are guiding you, who are teaching you, because both patient and senior teaching combined give you a good result at the end.
See, I have juniors, pediatricians who are doing the residency. Once you enter, uh, except a few, mostly we are not very fond of our seniors, but build that rapport, and soon you will find that actually the advice that you get from your seniors is golden, and it does help you in, they help you in not repeating the mistakes which they have done. So it is a skill that is also needed while doing residency. So, Dr. Ihna, this would not have been possible without, the support of other people in your life. So, to whom would you like to dedicate this success? Any shout outs?
First of all, my parents, my brother, and my sister in law, they have been the pillars since I was a child. I was their priority. Being the younger one, I have always been their priority. So, in those 4 months, even though we had some familial issues, a loss, a death, so after that, also my parents gave me that environment. In 2 months, I could crack this. It is also because they had gone through that grilling with me day and night. I was only studying, doing nothing else, only studying. So it goes to my parents. I would dedicate all of it to my parents, my brother, and my sister in law. Then, secondly, I would say I had immense support from my seniors. I had seniors from PGI, seniors from AIMS Delhi, and they were supporting me day in and day out. They were guiding me at each step. I would ask them what to read for biostats, what to read for each topic. I would ask them that where should I read this from, where should I see the images from, where should I focus for different topics if they would come in the previous year question and not given in AIMS protocol, where should I go to, which source should I take? So I would give it to the seniors as well for guiding me well. I would not have achieved this if you were not there, because I remember from my PG days, I was seeing your videos. I was always following what you would say. Then in my MD, I was seeing your videos, not only your videos regarding the curriculum, but also about the toppers. Like you used to ask what the toppers did. And I had a notebook since my January. So I used to write all the points that you had asked to the seniors and the ones who have got selected and they had mentioned. I made a note of all those pointers that they were saying, be it Rudresh sir, be it any other senior. I would make a note of all these. Alisha ma'am, they've all been my seniors. So I made sure that I'll do whatever they have done. So it goes out to you as well. And then God, I think the stars match only when God wants it to match.
Absolutely, absolutely. Uh, Initially, it was Alicia. Now it is you. Maybe tomorrow it is going to be somebody else who will be saying the same thing that I listened to the interview of Ihina. So I think it's a cycle of positive karma which should go on. Dr. Ihina, one more thing. Since you talked about biostats,
Right.
what about biostats? Everyone knows questions come not in NEET SS but in INI SS. How did you tackle that?
First of all, Saurabh Datta sir, as we all know, he does a methodology workshop. So we all go to that workshop. We all follow that small booklet that he gives. Then he also has a video on YouTube. I had seen it almost twice or thrice. Then my seniors had sent me some articles or some presentations that they had, which are being conducted in PGI. So I've gone through those presentations or those articles. But purely it was Saurabh Datta sir's contribution, I would say. other than the latest part, that what studies are being done or further about that, but not the basics. For the basics, I followed Saurabh Datta sir's booklet that I had.
I'm actually feeling nostalgic because even
Yes.
I have attended that
Yes, sir.
class. At that time, the handouts given by sir was not a booklet; it was more of a like a print photostat
Okay.
kind of thing sir would share at that time. But again, it was very good.
Yes.
But nice to know that. So, students, biostats is important if you're targeting INISS because there will be significant questions, and this is one area where people are not generally good at. So you can actually cover up in case you have made some silly mistake. You can actually cover up in the biostats part if you're targeting INISS. Dr. Hina, any last words you would like to say? Your friends, your apart from family members, anybody you want to thank?
So my friends, especially my best friends, have always been the support, because for 2 months I was not available. I would not reply to the text. I would not pick up anybody's calls, and they understood it. So having that support system behind my back was also important. And at the end, I would also like to mention that people should not take it to heart. People should try to learn the subject rather than just running behind the ranks, running behind the MCQs. I have learned it the harder way and have reached here. So I would like everybody to learn this, that you need to learn the subject, you need to learn how to treat a patient before becoming rank one or any other target that you have in mind. If you are good at your skills, you will ultimately achieve the goal that you have thought of.
So rightly said. So rightly said. If you run after ranks, ranks will elude you. You run after excellence, rank will come to you as rank has come to Dr. Hina and rank one. I don't think it can get bigger than this. So lovely talking to you, Dr. Hina. It was my pleasure, my privilege to be taking your interview. And before we finish off, what place you are going to join? I know it's a tough call. Made up your mind or yet to do? Yet to make up your mind?
Sir, I'm yet to make up my mind. I've not yet finalized. I'm still juggling between AIMS Delhi and PGI, because AIMS Delhi has a tag and PGI is my alma mater. So I still not finalized it yet.
So it's a good thing. Having so many options and then struggling with that
Yes.
is a privilege not everyone gets. So you have sufficient time, you can make up your mind, Hannah. And lovely talking to you, Dr. Hina. And on behalf of the entire PrepLadder Super Specialty team, I wish you all the very best for a great future. And I do hope to see your name in the next AIMS protocol edition when it comes out, right? Some of the contributors are already my friends, seniors.
Yes, sir.
I know them personally. Now, maybe 3 years from now, I will be telling, okay, the new AIMS protocol volume 4, Ihina was the girl. I had taken her interview. So thank you so much for your time.
Thank you so much, sir.
Thank you. And all the very best.
Thank you so much, sir.